So Simon, what do patients need to know for recognizing the signs and symptoms of blood clots?
I think for cancer patients, the signs and symptoms of blood clots are very similar to those in people who don't have cancer. So swelling of the leg, pain, redness, or for a pulmonary embolism, breathlessness, chest pain.
Of course.
The difficulty is that those symptoms I've just described are often commonly found in people who have cancer anyway. So you could be breathless because you are anemic, or you have fluid on the lung, or you have tumour on the lung. And so therefore people don't always recognise that these symptoms are due to the blood clot. They put it down to something else. So I think patients need to have a low index of suspicion to ask for help and ask for someone to consider this. So my message is this: patients and doctors and healthcare professionals need to have a low index of suspicion to think about clots. Patients need to ask about clots.
We don't want to dismiss it just because it's a sign and symptom.
We often believe what we want to, and having to get another test when we think it could be due to something else. No, have a low index of suspicion. This is something that can kill. This is something that, if picked up early, can be treated.
Absolutely. So what would you say are the top 3 questions cancer patients can take to their healthcare teams in order to get the best results and the best answers right away?
I think the best way for cancer patients to get information to prevent blood clots, I think number 1, say to your healthcare professionals, what is my risk of getting blood clots on this cancer treatment? Number 2, what should I be looking out for which may suggest I have a blood clot? And number 3, if I'm worried that I may have a blood clot, who should I contact?